So this discussion is focused on data measurement. So when I say data measurement, how will you measure the data that will answer the objectives of your study? So we have talked about your objectives, we've talked about the definition of terms. The next thing perhaps that we need to think of is how to measure the data. That would be answered by this section. So when I talk about measurement, if especially for dealing about quantitative research, because when I deal with or when I say measurement, its focus would be quantitative research. So one of the advantage of measurement is to remove the subjectivity and guesswork. Okay, since measurement is based on rules, hence findings can be verified. So when I say measurement, just think, for example, when I'm talking about a tumor, when I'm talking about a cyst, when I'm talking about cancer, I would want to measure the size of the cancer. Okay? Rather than for my patient to say, oh, your cancer is too big, I need to quantify it. It allows me to remove the subjectivity because what might be big for somebody might be small for somebody else. So I need to remove the subjectivity. It reasonably helps us to obtain precise information, and then it could communicate numbers which is more exact compared to words. Because if we will be using the qualitative description of a certain measure, we will have a tendency to have errors. Okay, it has a tendency to be erroneous. So what we're going to do is measurement. Okay, measurement is our choice to make it more precise. Now, errors in measurement. Since we're talking about measurement, there could be possible errors also when we are measuring the data of our objectives or data that would answer our objectives. So this error is the difference in the actual amount and the amount of the attribute that was measured. So in other words, it is the difference between the true score and then the observed score. What are possible sources of this? It could be that you have an equipment error. It could be that the researcher or the data gatherer was not oriented on what type of measurement would it be done or how would it be done. Hence, there is a difference between the true score and the observed score. Our goal as researchers is to reduce, if not eliminate. Okay? So your goal is either to eliminate or reduce the errors in measurement. Because the bigger the error in measurement, it would appear in your statistical analysis that there are a lot of extraneous data, meaning data that are out of bounds, so it will be difficult for us to analyze. Now, let's talk about the type of measurement errors. You need to understand the type of measurement errors for you later on to avoid this type of measurement errors. Okay? Understanding of this will make you avoid or help you avoid the measurement errors. Now, random error. When I say random, it happened. It just happened by chance. So it is expected and is affected by a host of influences that may be present in an experiment. It could be due to human errors such as confusion, bias, variation, and procedures as well as data processing. Okay, so for example, the researcher is just confused how to do this, what to do. When I say bias, for example, you have an inclination to say, oh, that person is really beautiful because you might be inclined to like that person. Or you might say, I'm a level 3 student nurse. I don't want that the result of the student nurse among level 3 would be low. So you would have the tendency, okay, let's have the result modified. But we are not supposed to do that. Okay, that's bias. And then variation in the procedure as well as data processing. So when I say variation in the procedure, for example, your classmate used a ruler which is accurate, and you as a researcher used another ruler which is not accurate. Okay, there is variation in the procedure. That's why if ever we are using measurement, we would want the measure to be standardized. When I say standardized, if all of the weighing scale prior to the start of the experiment is set at 0, all of the weighing scale should be at 0. We would not say, it's okay to have that 1 kilogram. Later on, we will just deduct 1 kilogram. No, that's not how it works. If you're talking about measures or especially equipment, this equipment need to be calibrated. When I say calibrated, it needs to be checked by the manufacturer or even the distributor, okay, just to calibrate that it will indeed be accurate. It does not affect, take note, your random error does not affect the average scores of data, but affect the amount of variation that exists around the average scores. Okay, so highlight, it would affect the amount of variation. Next, you have the systematic error. When I say systematic error, this is a serious type of error. It appears to be accurate initially, while it remains to be consistently biased. Usually, the systematic error could be avoided if you're seeking the advice of the validators, if you're seeking an advice of other observers in the form of triangulation. So when I say triangulation, dear students, okay, when I say triangulation, instead of me alone gathering the data, I would ask a friend, I would ask another researcher to gather the data. When I say triangulation, you are trying to look into the data from three different perspectives. Okay, you're trying to look into the data from three different perspectives. So the three different perspectives is observer 1, observer 2, and then observer 3. That way, we can be able to confirm, we can be able to uh, compare the observation of observer A, observer B, observer C. Okay? One example of the study that I have supervised under this type of technique is that I had a student once who had an evaluation of pain scale among pediatrics. If you can recall the lessons in maternal and child nursing, we would usually use the face scale, specifically the Wong-Baker's face scale. Now, there are instances we know that another participant or another observer, would give it a score of 6 and then another would give a score of 4. So to avoid or to reduce the observer bias or the systematic error, what we did is to request 3 observers, a doctor, a nurse, and then another nurse for that matter. Okay, that would allow for the reduction of the systematic error. But we are very particular of your systematic error if we are dealing with experimental researches. In quantitative correlational researches, systematic error could be avoided by validity and reliability testing. Next, what are the sources of measurement errors? So it could be environmental contaminants. It could be the temperature, it could be the lighting, the time, the friendliness of the researchers, for example. Okay, these are possible environmental contaminants. That's why if we're doing experimental research, we would want the research to be done in a specific area, unless you would want to compare between area A and area B. What do I mean by specific area? That specific area should have the same soil component. That specific area should have the same humidity. That specific area should have the same exposure to your pest. Or else, it would be biased. For example, if one of the plants are planted in Baguio and then another one in Iloilo, and then we would compare if how is their growth. Okay, that would not be feasible because we know that weather in Baguio is way different from the weather here in the Iloilo. Now, what are the variation in personal factors? Fatigue, hunger, anxiety, or mood. For example, if you're doing an interview and then you profess to have somebody who is moody, or for example, you're also irritable, your participant would have a tendency also not to be very participative in your research because your attitude is projecting towards your participant. Okay, these are personal factors. How to avoid this? What we actually do prior to your data conduct, you should have a debriefing. Okay, you should have a debriefing. What is included in the debriefing? For example, if student A is doing the interview and then suddenly a respondent asks, "Student, what do you mean by this question?" And then the student does not actually know the answer. Okay, for example, you do not know the answer. Part of the debriefing is that I would tell you that, students, you are not supposed to say that you do not know the answer. Instead, for example, if there are 6 of you in the group, the 6 of you could gather the data. Okay, so you could be the data gatherer 1 up to 5. And then the team leader should be available to answer the questions of the 5. Okay, in such a way that, for example, if student 1 does not know the answer, student 1 could tell the participant, "In a while, sir, I would confirm with our team leader." You do not say, "I do not know the answer." Because by the time that you would say, "I do not know the answer," you're giving your participant the idea that, oops, it's their research. How come he does not know the answer? How come he does not know where we are going? Okay, so it gives your participant the idea that you do not know what you're doing. It's not good. Then quality of responses. The quality of responses talks about the accurate measures, the social desirability, acquiescence, and extreme responses which can cause potential problems in self-report measures. What are examples of this? Okay, for example, in the quality of responses, social desirability. For example, I will be talking about sexual practices of students. Okay, the question there is, are students really open to divulge their actual sexual practices? Okay, so there is social desirability. For example, we know that premarital sex is considered taboo in our society. So, if students are engaging, if ever, in premarital sex, will they be open for the discussion of that? Okay, that's one question that you need to ask yourself. And then other than that, social desirability. For example, your respondent already allowed to participate on your study, which is about a sensitive topic. You are not supposed to conduct your interview somewhere where a lot of people could listen to you. You should conduct your interview somewhere private. Okay, it should be done somewhere private. Okay, that's what we meant by quality of responses. Because if you will be asking people, and then if you'll be asking questions that would tend to demean them, or maybe that would tend to pass judgment on them, the tendency is for us to avoid these questions. Okay, we'll have the tendency to avoid these questions. Next, variation in data collection. So, different ways of collecting data, instruction, coding categories, and approaches. That's why later on, if you are making your questionnaire, I usually give my students the guidance that you should have a very clear instruction. That instruction should not be appropriate only for a student nurse in college level, but should be appropriate for somebody who finished high school. Okay? Other researchers would say, if your instrument could be understood by a grade 3 or a grade 4 student, you're good to go. Okay? But then that is just an arbitrary rule. Okay? So, basically our rule is that your respondent should be able to understand your questionnaire. Okay? Experience, for example, my experience in data gathering in research. For example, in my master's degree thesis, I had the Hiligaynon translation of the questionnaire. What I noticed is that during the translation of Hiligaynon, my patients or the family member of my patient tend to be actually lost in the line of translation. So it does not really mean that if you're using Hiligaynon, your respondent would right away understand. And if you're using Hiligaynon, my suggestion to you is to use simple Hiligaynon. Okay? To use simple vernacular language. Because there are vernacular language that are only understood by our lolas, lolos, and our ancestors perhaps. Okay? But the common society right now may not be able to understand the uncommon Hiligaynon words. Okay? So if you are using data collection tools, your instruction should be clear. Now, coding categories. When I say coding categories, it's just like, for example, I will say male is one. Okay, when you code in SPSS, guys, you are not supposed to write male, female. You are not supposed to write elementary, high school, college, undergraduate, postgraduate. No. Okay, in SPSS, it's numbers. So the translation of your answers, the answers of your respondent to numbers is referred to as coding. Okay, so oftentimes we say male is one, female is two. Okay, those are just codes, no? Now, you need to be clear among your group that male is one and female is two. I have encountered researchers, for example, one is in coding, no? The other researcher is in coding. He writes one male, two female, while the other researcher writes two male, one female. So during the analysis, there would be a big confusion if you were not able to agree as to how you code your data. Okay? Some of you might be asking, oh sir, does that mean that female are higher than men because there's number 2 for female? No guys, those are just numbers to represent, okay, the nominal variable. And then clarity of instrument. Okay? Oftentimes, we are very fond of making questions, questionnaire, we copy from the internet, we adopt it. Adopted questionnaires are good. But the thing that you need to think of is, can my participant understand this? Can my participant be able to answer this within 1 to 2 reads? Okay? If you yourself could not understand the question, dear student and dear researcher, remove the question. Change the question to the question you understand. Because that would imply that your question is a difficult one. And your participant may have the tendency to answer otherwise, not because your question is really difficult, but because your question could not be understood. And what would be the bottom line? Okay, we might say, okay, student choices have low knowledge. Whereas, the bottom line pala is that your question is poorly stated. Okay? For example, you also do not do double-barreled question. When I say double-barreled question, it's like this. I like mathematics and English. And then, for example, you will ask them to answer strongly agree, neutral, disagree, and then strongly disagree. Now, look at the question. I like math and English. What's the tendency? If I will encounter student A likes math. Okay, he'll give it strongly agree. And then you added English, and the student is like, oh my God, I hate English. So you're making the student decide between the two. And the interpretation will be different from each one of us. Some of you might say, okay, I'll answer 5 because I really love math. Whereas others would say, even if I love math, I hate English, so I'll answer neutral. Okay, I don't want to take sides on this. I'll answer neutral. That's a double-barreled question. Okay, that's just a simple example. So when we are asking your questions, especially on attitude questions, you are not supposed to write double-barreled questions. You are not supposed to write questions wherein you need to answer or you need to choose between the two. Okay, you're not supposed to do that. Okay? Next, sampling of questionnaire items. Now, for the sampling of questionnaire items, it depends on what items are included as discussed and learned. Okay? So again, sampling of questionnaire items, that would depend on what items are included as discussed and learned. What do I mean by that? For example, I'm giving you my exams in research. And then, I have had questions which we did not discuss. I had questions which is not even found in the references and the handouts that I have given you. What's your tendency? You would have low scores. Okay? But that low scores is not because you did not study. That low scores is not because you did not understand research. It's not because you did not understand my discussion, but the low scores were brought about by the fact that I included items that were not included in our topics. Okay? So, that's sampling of questionnaire items. So, where are we very particular of this? For example, if I'm doing a little experiment, and let's say, for example, I would want to find out if my lecture about HIV is effective. Lecture about HIV is effective. And then, for example, let's say I'm thinking I do not want the scores to be low. So instead, what I did was to choose only the items about HIV which are easy, okay, which are easy to understand. So if that will be the case, it's biased. It will be unfair because I'm just choosing questions which are easy. And then if the result would come out and then the scores will be high, I would say, okay, students understand, or maybe my participants understood the way I discuss HIV. Okay, that would give me a false idea. That would give me the false idea that my lecture is very effective. Okay, so that's about sampling of questionnaire items. In other words, ideally, for example, in education, we should have the table of specifications. Excuse me. In the table of specifications, it is where we indicate the number of items that we would have for our coverage. So, for example, if I discuss the topic, let's talk about medical surgical. If I discuss the topic neurology for a very long period of time, let's say, for example, 3 weeks, and then I discuss gastroenterology for 2 weeks, it would mean that I would need to have more items from neuro for my major exam rather than gastro, because it should be proportional to the time that I have allotted for discussion. Again, it should be proportionate to the time that I have allotted for discussion. Okay, that's how it would work. Next, format of the instrument. So the technical aspect, and then the open versus close-ended, and then the oral versus written. So let's say technical aspect. Is your Englishing there correct? Okay, is your grammar correct? Because if you might be Englishing, you don't want that to happen because people will misunderstood. If you're talking about scholarly, for example, your participants are inclined on the academics, and then they read that your questionnaire is wrongly structured, and then the grammar is wrong, most of them would not answer it because they would find it confusing. Next, open versus close-ended. Open-ended questions are best if you would want to explore further. Close-ended questions are best if you would want to have a direct answer and a right-away answer for your question. And then oral versus written. Oftentimes we have the tendency that when we write a questionnaire and then we will be using it for interview, we will have a tendency to, okay, let's just have the same questions or let's just structure it the same. But take note, guys, if you're doing an interview, especially if you're asking other people to do the interview for you, for example, you would have the data gatherers, and then, for example, in your group wherein you'll have six, okay, in a group activity in research wherein you have six members, you need to have the script in the questionnaire itself that will be used for interview. That's to ensure that each one of you will be able to say each one of you will be able to say it. Okay? Each one of you will be able to say it in the same language as you have agreed. Okay? What I mean is that when you have your interview schedule should appear like a script by the time that you're doing your interview. Okay? Do not say, for example, in the interview schedule. By the way, when I say interview schedule, it's like a questionnaire used for an interview. Okay? It's an exact questionnaire used for an interview. You need to differentiate between interview schedule and interview guide. When I say interview guide, an interview guide is like a set of guide questions that will be able to guide you by the time that you're probing the answer of your participants. Okay, so guide questions or interview guide tend to be open-ended. Interview schedule tend to be close-ended. Okay, now going back to my example. Let's say, for example, you're doing an interview and then instruction. Read each item carefully. Encircle your choice or encircle the best answer. So come to think of it, you're doing an interview and then you will instruct them to encircle the best answer. Really, are you doing an interview or will you ask the participant to answer? So if you're doing an interview, your instruction should sound like, good morning, I am doing an interview. This interview is intended for, I will be asking you questions and I will be expecting responses from you. If you do not understand my question, feel free to tell me so that I will be able to repeat it. Okay? That's how an interview schedule should sound. Next, you have your strategies to minimize measurement errors. So one, measurability or reliability. So reliability, again, is a measure of consistency with which an instrument measures the attribute. It also measures the accuracy, how the true score, okay, of an instrument which shows the true score and minimize the error component of the obtained score. Reliability affects the precision of a measure. Okay, it would affect the precision of a certain measure. Next, stability of measurement. Now, in stability of measurement, okay, uh, it talks about the same samples on separate occasions. It talks about test, retest, reliability procedure to compare the scores by computing the reliability coefficient, which measures the magnitudes of test reliability. It allows for proper calibration of physical instrument and keeping the instrument in top working conditions and well calibrated that will ensure the stability of your measurement. Now, let's picture an example using a questionnaire. When I say stability of measurement using test retest, it's like this. Okay? For example, I have a 10-item questionnaire. And then I conducted a pretest. If my intended sample size is supposed to be 300, my pretest size should be 10% of my sample size. So my pretest respondents would be 30 because 10% of 300 is 30. Now, if you have that 10-item questionnaire, for example, okay, I'm giving it to everybody right now, no? As I'm distributing it, okay, for the purpose of pretest. And then the scores are the 9, somebody scored 8, somebody scored 6, somebody scored 9, somebody scored 7. If I will be doing the test retest reliability procedure, what would happen is that after 2 weeks, I would give them the same question to the same respondents. And I would like to check if they have the same scores. Okay? or we are actually doing statistical analysis there. So it's not really that they would have the same exact score, but their score should be related to one another. Okay, for example, in the next examination, this participant scored 8, 8, then participant scored 6, she scored 9, and another participant here scored 8. I could say that somehow my questionnaire is reliable because majority of them had the same scores. And then for this one, she had a -1, this one had a +1. Okay, so it's not a very big difference. Okay, it's not a very big difference for that matter. Okay, now taking that into consideration, but we just don't look at this, we do statistical analysis using SPSS. Okay, we run tests in statistic and SPSS to find out if it is reliable or not. But basically, when I say stability of measurement, it simply means that if ever I will be doing it twice, I will be doing it thrice, I will be able to get the same result. Okay, in the same way, for example, if I'm using the weighing scale, if I weigh the child now, the child is 26 kilograms. If I will weigh the child 30 minutes later, I'm sure that the child should be 26 kilograms still. Okay, that's stability of measurement. Next, internal consistency. It shows that all indicators, highlight that, all indicators or subparts, okay, measures the same characteristics or attributes of the variable. You have split half technique and then Cronbach alpha or coefficient alpha. We are commonly using Cronbach alpha if we're talking about knowledge questionnaire. We are using split half technique if we're using about attitude questionnaire. Okay, now, what do I mean by internal consistency? For example, I would want to know your knowledge about vaccination. Okay, I would want to know your knowledge about vaccination. My question number 1 is vaccines help us develop. For example, vaccines help us develop what kind of immunity? Passive immunity. Okay. Then let's say it's a true or false question. Number 2, vaccines are developed in the laboratory with several steps of research. Okay. Now, if I would want to ensure that my questionnaire is internally consistent, if question number 1 is talking about vaccine, question number 2 is talking about vaccine, question number 3, 4, 5, up to 10 should talk about vaccine. Okay? Allow me to give the example. For example, your question is about vaccine knowledge. And then suddenly you inserted here a question about acute kidney disease. Okay, acute kidney injury is caused by pre-renal, intrarenal, and post-renal, for example. And then your respondent got wrong here, got wrong in this question. Okay, will that indicate that your respondent has a poor knowledge about vaccine? That would be a no, because your question here is not pertaining to vaccine. If I will be doing a reliability test, the Cronbach alpha would turn out to be very low because some of your questions are not consistent and it does not measure the same attributes of the variable. Guys, your Cronbach alpha works and your split half reliability works in such a way that it would check if your respondent would have an answer, or if your respondent have a correct answer from number 1 to 3, is it the same in number 8 to 10? Is it the same in numbers 5 to 7? Okay? Because basically, if you are measuring the same variable, if you are measuring knowledge all throughout the questionnaire, if you are intelligent on the first part, you're supposed to be intelligent on the second part and the third part of the question. If your questionnaire indeed measures one specific type of variable. Okay? It's one specific type of variable. Okay, let's talk about equivalence. Now, when I say equivalence, it talks about high consistency or agreement and congruence in the observation ratings of the different observers or raters of a certain phenomenon. Now, your goal here is estimates of 98. Okay, 98% indicates high correlation between agreement of observers. Now, what do we mean by this? For example, earlier I talked about the 3 observers. Okay? We are not really sure if all of them would have the same measures. But our goal is that there should be a reliability estimate of 98%. Okay? Which means that the observation of observer 1 is not far from the observation of observer 2 and observation of observer 3. Okay? If their observation are far from one another, meaning you will have a problem with equivalence. It means that one of your observers may not be properly acquainted, or your instrument is not valid for the purpose of your examination or for the purpose of your assessment. Now, going back first to Cronbach alpha and split half reliability. For Cronbach alpha and split half reliability, the goal score is 0.7. Again, the goal score is 0.7. I would consider an instrument reliable, okay, and the instrument could already be used for standard testing if the Cronbach alpha coefficient, okay, if the Cronbach alpha coefficient is greater than 0.7. Okay, that's how it works for your reliability testing. Next, split half technique. Okay, that would be almost the same purpose as your Cronbach alpha. It determines the homogeneity of items. It's split in half and correlational procedure. Odd or even items are scored and reliability between the two will be high if your questionnaire is reliable. It's the same almost as your Cronbach alpha, but what happens in your split half is that, for example, if you have a 6-item questionnaire, SPSS will get the scores for item 1, item 3, and item 5, and then merge that with item 2, 4, and 6. I mean, compare that with item 2, 4, and 6. If your questionnaire is consistent, your split half technique would be able to give you a high reliability coefficient. Okay, that's your split half technique. Next, the Cronbach alpha coefficient. We've already talked about that. Okay, it's an estimate also of your split half correlation. Then you have the Kuder-Richardson. Your KR20 coefficient is best used for questionnaires which are yes or no, true or false. It requires consistency of responses to all the items of a single form of test that is administered in one time. Okay, so take note, this is best for single form of test administered at one time, and it considers all items. Next, you have validity. Okay, validity is checking that the questionnaire measures what it intends to measure. Okay, the degree by which the instrument measures what it intends to measure. So validity should prove that the instrument will consistently measure the right variables to be investigated. So you have the following types: content validity, phase validity, criterion-related validity, and construct validity. Oftentimes, we are going into content validity wherein you present your research among 3 experts in research and 3 experts in the field that you are studying. Okay, and then you will ask them to evaluate whether the questionnaire is appropriate for your variable. And then they will tell you, oh, this question is not appropriate. You better revise this. This question is inappropriate. You better revise or change this or remove this. That's how validity works. So, content validity, it's concerned with the content of the adequacy. Okay, it's concerned with the adequacy of content of the area being measured. Phase validity, concepts or variables desired by the researcher in the study. And criterion-related validity, you are looking into some criteria, and then the measurement is valid if it strongly corresponds with the score criterion, meaning it can predict attitude, behavior, experiences, among others. Okay? Now, for criterion-related validity, for example, I'm talking about level of stress. Okay? For example, there's already this 20-item questionnaire from my psych book which tells me that this is the best questionnaire for the level of stress. But as a researcher, I would want to develop a new questionnaire for level of stress. And then I am making a 10-item questionnaire. What I will do is to compare the result of the 20-item questionnaire to that of the 10-item questionnaire. This 20-item questionnaire becomes my standard. That 20-item questionnaire becomes my criterion. Okay, and then I will find out if my 10-item questionnaire that I just developed will have the same. Okay, if the 10-item questionnaire that I develop will have the same contents as the 20-item questionnaire. Okay? Next, there are 2 types of criterion-related validity. predictive validity, and then concurrent validity. Predictive, it is to differentiate between performance on behavior on some future criterion outcome. So look at the word predictive. It's predictive future criterion outcome. Concurrent. If it is concurrent, it is the ability to measure the differences on the present status on some criterion. Okay, present status on some criterion. Take note of that. Okay, concurrent, it's talking about present, whereas your predictive future. Now, construct validity. Construct validity is reducing the concept abstraction into more concrete and suitable criterion-related validation. To validate this instrument, we are using the process of hypothesis testing. So, we gather the data and test the bar being scores of the sample to make inferences based on the findings and determine the rationale whether the construction of the instrument is adequate to explain the findings. Okay, so basically you are looking into each item and to check if each item is adequate to explain the findings. Then you have the term sensitivity and specificity. The term sensitivity and specificity, dear researchers, is best used if we're talking about diagnostic tests. So guys, when I talk about sensitivity and specificity, this is oftentimes used as a measure for diagnostic test. Okay, for example, if I'm talking about dengue test, I'm talking about typhoid test, I'm talking about COVID-19 test, okay, sensitivity and specificity is very important. Okay, now, sensitivity. Sensitivity is the ability of the instrument to correctly screen or identify the variables to be manipulated and measured to diagnose its condition. Okay, in medicine or in medical parlance, we refer to that as rule in. Okay, to rule in. Okay, yung mga ball pen, rule in. Now, when I talk about specificity, dear students, specificity is the ability of the instrument to correctly identify non-cases or extraneous variables and screen out those conditions not necessarily for manipulation. Another term for specificity is rule out. Another term for specificity is rule out. Sir, what is rule in? What is rule out? For example, you have dengue test. No? If you have dengue fever, there are two tests for dengue. You have the dengue NS1. Okay, you have dengue NS1. And then you have the dengue duo. Okay, or the dengue IgG IgM. Dengue IgG and dengue IgM. Okay, you're discussing that under infectious diseases. So, if I'm talking about sensitivity, if I say rule in, it answers the question, if I got positive in my dengue test, how sure am I that this positive is an accurate positive? Okay, how sure am I that this one is accurately positive? If it is really accurate, if it is surely accurate, you could say that the diagnostic test is 100% positive. 100% sensitive, I mean. Okay? Now, to put it in context, plus it is possible for you to be testing positive in dengue, but actually you don't have dengue. It's also possible for you to be negative in dengue, however, you also have dengue. Okay? Again, it's possible for you to be positive in the diagnostic test of dengue, but you don't actually have dengue. It's also possible for you that your dengue test turned out to be negative, but you have dengue. Okay, that's the role of sensitivity and specificity. So you might be asking the question, okay, sir, so are those diagnostic tests not 100% effective? Yes, they are not 100% effective. That's why in nursing, in medicine, we are learning the signs and symptoms of our patient because we do not treat the laboratory result, we always treat our patient. For example, even if the dengue test of my patient would turn out negative, but then my patient has rashes, the characteristic petechial rash in dengue, and then for example, my patient had fever, and then after several days, the rashes appeared, and then for example, my patient have internal bleeding, I won't have a choice but to consider that my patient is a strong dengue suspect. even if the dengue test is negative. Okay? Or maybe I need to find out other causes for the bleeding. Now, going back to sensitivity, I said rule in. So it means that once you get a positive test result, how sure are we that this positive result is indeed positive? Specificity. If I get the negative result, how sure am I that I don't really have the disease? Okay, that's specificity. Now, just for the purpose of interest of the public, try to look into the COVID-19 test sensitivity and specificity. It is where you will find out the reason, guys, that even if your tested negative in COVID-19, if you have had an exposure, you will still be advised by the epidemiologist, you will still be advised by healthcare professionals to minimize your exposure to the public. Because it is still possible that even if you're negative for COVID-19, you might actually still carry COVID-19. Okay, because the specificity of COVID-19 test is not yet well established. Okay, so that's the purpose of your sensitivity and specificity. Okay, again, sensitivity to rule in, pag positive ka, alam ko bang yan nga ba ang sakit mo? Specificity to rule it out, if you have negative, am I sure that you don't have the disease? Okay, I hope that you'll remember that. You go back to your concepts in community health nursing and you go back to your concepts in epidemiology for you to understand that further. Next, let's talk about assessing qualitative data. Okay? Qualitative data. Our goal in assessment of qualitative data is that how can I make sure that those descriptions that you are giving to your participants or those descriptions to your participants are indeed the true state of their human experience. Okay, the true state of their human experience. Because that is necessary to influence the acceptance of authorities. For example, you'll be talking about my participants experience depression. How sure are you that that is really depression? What is your basis? What are the statements? What is the process that you underwent to ensure that you are having the rich description of those statements? So to aid us on that, Lincoln and Guba has formulated the 5 criteria for your qualitative research. There are a lot of criteria in qualitative research, no? There are a lot. There's various. But I will be discussing Lincoln and Guba, 1985, 5 criteria for qualitative research. 1, credibility. So when I say credibility, it is the confidence and the truthfulness of the data. Okay? There are various techniques that can be done to improve the document credibility of qualitative data, and this is done by when the believability is enhanced. Now, confidence and truthfulness. How sure am I that the data that she's talking about is truthful? So we try to explore. We do in-depth interview. When I say in-depth interview, for example, your respondent would say, or your participant would say, I feel very sad about this experience. You do not just say, okay, it's very sad, he's having depression. Do not conclude like that. You need to explore further. Ma'am, what do you mean by very sad? Okay? What do you mean by very sad? And then she will say, I cried when I heard about those. And then you will say, Ma'am, what specific event wherein you cried? What you are trying to explore there is to build up that indeed she is very sad about the incident and that is his experience that he would want to share to you. Okay? That's the truthfulness of the data. Other than that, if you're doing the interview, you would want to make sure, if you're doing the interview online, for example, you would want to make sure that your participant is alone in the room. Because you don't want your participant to be talking to somebody else and then ask the question, hey, what will I answer to these researchers? How will I respond to this question? You don't want a coach during that interview. Okay, so you need to make sure that your participant is alone to develop credibility. So, what are the steps for demonstrating credibility? 1, prolonged engagement. When I say prolonged engagement, you do not say, Ma'am, we will interview you for 30 minutes. Guys, if you're doing the qualitative research, there is no time limit for your interview. There is no time limit for your interview. What I mean is that if your participant is still talking about the topic related to your interview, keep her going. Keep her going. because that is prolonged engagement. You would want to spend time in the data, engaging their views and understanding their feelings. Do not say, ma'am, it's already time because we have class in research. No, that's not how it's supposed to be. Next, persistent observations. You observe what is relevant to the phenomenon being studied to the point of saturation. What do I mean by that? For example, if you're doing the interview and then you notice that she is appearing sad or she is having grimace, you could say, ma'am, I've noticed that you appear sad. Ma'am, I've noticed that you made that expression in your face when you talk about your boyfriend. Ma'am, I noticed that when you were talking about this experience, your tears fell down. Is there anything else that you would want to share to us? Okay? So you're trying to make observations. But do not judge. Ma'am, I saw you cried. I know you're depressed. It must have been hard. Okay? Class, do not conclude. Do not conclude. And the next, triangulation. So if you're doing your interview, that's why there are several of you, because that would help you triangulate. Because some of you might think, oh, she's really sad, that's an emergency. But actually, for your classmate, it's not. Okay, so try to look into that. Triangulation. Next, peer debriefing and member checks. So when I say peer debriefing, okay, and member checks, you ask the study participants' reactions to preliminary findings and interpretations of the inquiry. Okay, so peer debriefing. I would debrief my members and then I would tell them this is how the interview would look like. I don't want it to appear that you are taking down notes during the interview. You need to inform the participant that you are taking down notes, but do not make them conscious that you are taking down notes in front of them. Okay? You're also not supposed to cry in the front of your participants because that's not therapeutic on their part. That's peer debriefing. I am orienting you on what to do. I am orienting you on how you're supposed to approach your participants. Peer debriefing could be done within your group. Okay, peer debriefing could be done within your group. Then, member check. Member check here is that you have your participants as your members. Okay? Your participants are your members. So you try to ask them at the end of your discussion and analysis. You try to ask them and tell them, ma'am, these are our findings. This is our interpretation of the topics that you have shared to us. Were we able to understand it correctly? Were we able to have the accurate description of those experiences? That's how you do member check. And then you search for disconforming evidence. You search the data that could challenge emerging concept or descriptive theory. Proposed sampling and facilitated by prolonged engagement and debriefing. Okay, so class, after your analysis, you would look for theories that would agree and disagree to your data. That would help you to have your credibility. Next, dependability. Dependability is concerned with the stability for a long period of time. So what we do is stepwise replication and then conduct inquiries separately and then compare their data and conclusion. So when I say dependability, the tendency class of the researcher is to look at the data several times, and then class you would try to interview them separately because you don't want to interview them at a single instance wherein they will be giving each other's idea. Okay, they will be sharing ideas to one another. That's dependability. Then confirmability. It is the objectivity and the neutrality of the data. So highlight objectivity and neutrality of the data to determine accuracy, relevance, and meaning of the data. In other words, the findings must reflect the participants' opinion, feelings, and attitude regarding the inquiry and not the opinions, bias, or perspective. So class, in confirmability, one thing that you could do is what we refer to as journaling, okay, or memoing. No? So you have journaling, you also have memoing. Okay, that's for confirmability. And then you do your return interview. Return interview is the one that I've described earlier. So the one that I've described earlier is that I would say, I would do an interview again. Okay, I would do an interview again and then ask them and tell them. Okay, ask them and tell them if these results are indeed accurate or consistent with the one that I have taken from them. That's the return interview. In other words, you interview them again to confirm if the findings that you did are indeed accurate. Okay, that's return interview. Now, memoing and journaling. When I say memoing and journaling, for example, across the line of the interview, you were able to relate to the participant's experience. Let's say, for example, the participant was telling you how sad it was, and then along the way, your emotions were also affected. So you need to memo this. You need to indicate it in a journal. What's the purpose of the memo and the journal? So your memo and journal is actually intended, class, for you later on to discern, for you later on to try to find out if your emotions has possibly affected, if your emotions has possibly affected your interpretation of the data. Okay? So I don't want that your sad feelings about the interview would be included in the interpretation, because you will have the tendency that it is already your emotions flowing and it is not the emotions of the participants that are reflected on the interpretation. So you need to make sure that these are accurately reflected. So class, the purpose of the journal is that by the time that you will be doing your analysis, you need to open the journal and then try to find out, okay, what's in the journal that is inconsistent, or what's in the journal that could possibly influence my interpretation of the data. That is confirmability. Next, transferability. When I say transferability, the research findings can be transferred or applied to other settings. And this could be done by a thorough and sufficient descriptive data of research setting and the processes observed during inquiry. Now, to discuss further, transferability, guys, is the main challenge in qualitative research. Why? If I will be doing my interview among 6 participants, the result of this interview would only be applicable to these 6 participants. So, the goal of your qualitative research is that supposedly other participants, or I mean other people who are having the same experience, could possibly gather or take something from our research from these 6 participants. And that is transferability. Basically, is this result transferable? Is this result applicable to another group of people with the same characteristics who were not included in the interview? That's transferability. Now, for your qualitative researchers, they are aiming for transferability through a thick description, through a very detailed description of the experience. According to them, if this experience is adequately described, okay, if this experience is adequately described, they will be able to transfer it to other participants. Okay, that description will be transferred to other participants. Okay? Now, the main strategy to enhance your qualitative data analysis would go back to intensive listening during an interview. Okay, it's intensive listening during an interview. So, you need to do that. Okay, you need to have your full attention when you're doing the interview. That's it for these slides. If you have any questions, feel free to communicate it now.